Hello, YouTubers. Joe Kersey here on Thursday, April 3rd at 1 p.m. Eastern Time, 2014. Today, I want to tell you another story from my surgical days. Well, medical days, but specifically my surgery internship year, first year residency year. And this involves a now deceased French hepatobiliary pancreas surgeon named Maurice Mercardier. Now, I'd tell you stories involving the chairman, who I greatly admired, Dr. Larry Carey, but he's still alive. I don't have a negative thing to say or thought about Dr. Carey. But since he's still alive, I'm not going to tell you stories about him, except to say I greatly admire and respect the man. But since Dr. Zollinger's dead and Dr. McCartier are dead, since they're both dead, and since I certainly admired Dr. Zollinger greatly, and I met Dr. McCartier just one time, he was just great friends with Dr. Zollinger. I do feel, that it's allowable for me to talk about them somewhat. And again, nothing negative at all. I haven't got a negative word to say about either of these guys. But, like many people who are in the top of their field, there's a lot of colorful things that surround them that you can get a kick out of. So, let me just tell you a little bit about this McCartier fella first, and then we'll get on to the other heart of the matters. In 1981, this story happened in 1976 that I'm going to tell you. But in 1981, Dr. McCartier was made an honorary fellow of the Canadian College of Surgeons and Canadian Royal College of Surgeons, and the citation says that he's a professor of surgery at the University of Paris and chief surgeon to the Hôpital de la Pitié, Chevalier of the Legion of Honor, officer of the Order of the National Merit, honorary fellow of the American College of Surgeons, and then they talk about that in the war, during the Second World War, he was a member of the resistance and was present at the liberation of Paris and that sort of thing. And now they wanted, the Canadian folks wanted to honor him. They said he was a great friend of the British and so forth. And he oh, blast here. Here we go. My PDF file just jumped around like mad here on me. There we are. Here we go. Okay. So the fellow who was introducing him at this ceremony talked about Dr. McCartier's love of wine, and he said that he had talked to this man's wife, Dr. McCartier's wife, and she allowed that Dr. McCartier loved to practice the art of, l'art culinaire, the culinary art. And she said that the results are good, but when she enters the kitchen after his efforts are complete, there's an impression of, un champ de bataille, which, field of battle. So he also practiced gardening with enthusiasm. And as it turns out, he was particularly fond of roses, as was Dr. Zollinger. And so he introduced Dr. McCartier to the audience, and so that gives you a little bit of background on this man. But so in 1976, I don't know, this may have been in late 1970. It was probably in 1976 sometimes, but it was either in 75 or 76. Dr. McCartier came to visit Dr. Zollinger, who was then the retired chairman. He was, the professor emeritus and chairman emeritus of the Department of Surgery at Ohio State University. And these guys were great buddies. They had met during the war. Dr. Zollinger had been with a field hospital unit in the Army. Harvard sort of put together a field unit, and he was a member of that unit that went over to Europe to serve in the European Theater War, and he met McCartier there, and they remained friends, from then on. And since Dr. Zollinger was quite the gastric and pancreatic surgeon, and Dr. McCartier was quite the pancreatic and hepatobiliary surgeon, as was Dr. Zollinger, among other things. But that was sort of one of his major interests. They remained friends, and it turns out they both like to grow roses, and they both like the occasional glass of wine, and so forth. And so Dr. McCartier came over to visit Dr. Zollinger and stayed at his house out in Bexley, which is a very upscale, I wouldn't call it a suburb now, but at that time, was a suburb, meaning it was just outside the, immediately adjacent to, but outside the city of Columbus. But when he came over in 75, it was very much surrounded by Columbus, but still very much its own city. So on the night before what I'm about to tell you happened, it seems that Dr. McCartier and Dr. Zollinger, were sitting in Dr. Zollinger's kitchen and having a few wines. And, earlier in the day that they had examined Dr. Zollinger's rose bushes. He was quite the rose grower, and what he would do is he would take the expired blood from the blood bank, after it became out of date and hadn't been used. He would take the blood home and put them on his roses, and he was encouraging Dr. McCartier to, he's got to put this expired blood on his roses, and figure out a way to get a supply of that, when he goes back to Paris. And it turns out that Dr. Zollinger also had cats. Well, he had a cat, and this particular cat, well, he may have had more than one cat, but this particular cat had an abscess on it. Now, if anybody's ever drained an abscess on an animal, or for that matter, drained an abscess on themselves, you know that sometimes these abscesses can contain a surprising amount of material. And when it comes out, while it might be very colorful and festive in terms of its color, it generally doesn't smell all that great. And of course, if it comes out under pressure, it can fly all over creation. Get in your face, in your hair, on your clothes, on the kitchen table. Well, it turns out that Dr. Zollinger and Dr. McCartier thought that the appropriate thing to do to this cat was drain this abscess. Well, it's, cats aren't going to really willingly lie down on the kitchen table and, let you drain an abscess. So they got the cat drunk. And after the cat had neared, sort of low-grade insentiateness, they proceeded to operate on this cat on Zollinger's kitchen table. Drained this abscess. Well, the cat did great. Cat did great. When you get the pus out, people always do better when you get the pus out of them. They do. Any creature does better if you get the pus out of it. So the cat did great. Meanwhile, then they retired to bed, and then Dr. McCartier was going to attend a conference the next day, as was Dr. Zollinger, as was I, as was Dr. Carey, as was indeed the entire surgery department. Because we were going to have a gala. Well, it was kind of an M&M, but it wasn't an M&M so much. It was a gala presentation. Now, for those of you unfamiliar with the routine of presenting a patient at any sort of medical gathering, there's a gnat flying around. There's always a sort of a pro forma, it's almost like a liturgy, how you present a patient. Ideally, you have the patient present if they're physically capable of being present, because sometimes, people want to quiz the patient. In this case, it wasn't possible. The guy was still alive, but it wasn't possible to drag him down to the room. And typically, the most senior resident on the service presents the patient. Gives the history and physical, the hospital course, the treatment, if any operations, what happened during the operation, the post-op course, and then, shows any x-rays. Well, now it would be, CAT scans, MRIs, and x-rays, any imaging studies, basically any visual aids. Sometimes you make slides and things. But typically, well, not typically, when it's done right, let's put it that way, you don't use notes. You know the whole thing off by heart. Well, so we were going to present this patient. Well, our service, Dr. Zollinger's old service, Surge 1, was going to present this patient with he had an acute pancreatitis. I'll tell you about him a little later. But present this particular patient, Dr. McCartier, and that's quite sort of the honor. That's very spiffy, Surge 1 was also Dr. Carey's service, and Surge 1 was Dr. Zollinger's old service, and still his service when he had patients, and he still was operating quite frequently. And so, much to my surprise and amazement, I, first-year resident, was told, I wasn't asked, I was told, you're going to present so-and-so to Dr. McCartier. I was given, well, I was told the day before. Well, that's plenty of time, because I'd been taking care of the guy. I'd been the sort of the primary, I actually had slept by this guy's bedside a few nights when I was on call. So, I knew this guy's case. And so as the guy that was most familiar with this guy's case, I was chosen to present to Dr. McCartier. Well, the significance of this selection was was not lost on me, nor was it not made clear to me. It's like you don't mess up. So in consideration of the significance of this event, the second year resident agreed to take over my floor duties for about 3 hours while I went down and familiarized myself intensively with the chart, which chart I had been interacting with basically, every day for the last, well, at this point, this guy had been in the hospital around a couple months, about 6-7 weeks anyway, 6 or 7 weeks. I'll tell you about this poor man. This poor man had a very checkered history, but had started to, basically get his act together and get his life together. He was one of these guys. See, remember the Alaska pipeline boom? Guys would go up to work on the pipeline. It was sort of like this, a lesser version of the Alaska gold rush in the 1890s. We'd go up to work on the Alaska pipeline, in the early 70s when they were building the pipeline. And this guy had gone up to work on the pipeline, and what had happened? I guess the folks that were building the pipeline, they really looked after these guys in terms of checking to be sure they weren't sick, and they would do routine chest X-rays and this sort of thing. And he got a routine chest X-ray, and they found one of these little coin lesions. Well, a coin lesion can be any number of things. It can either be bad or generally it's nothing. And so he he had a coin lesion. Well, what are you going to do? Well, sometimes you operate on those. You do a workup, and sometimes you don't. And in his case, somewhere along the line, it had been determined that this was called a hamartoma, which is basically just an overgrowth of tissue. It's like if you get like one of these little lumps and bumps on your arm, under your skin, that sort of thing, but it's in your lung. Completely, I don't know whether he had an actual thoracotomy biopsy of that or not. I think he did. I don't know whether he had it here at Ohio State or not, but in any case, he got over that really fast. He's a young guy, they heal fast, if they're not otherwise sick. So he came back from Alaska and got married, and he had a couple of kids, and he found a job. That was when you could still get a job. Doing an actual job as opposed to sitting around, talking on the phone. And so he and his family were out at a little street fair down in Waynesville, Ohio. And of course, I came from Warren County, and Waynesville is just in Warren County, and so I knew about this particular street fair that they had up there each year in Waynesville. Well, so he's at the street fair having a good time with his family, and he becomes seized with intense abdominal pain. In fact, abdominal pain so severe and also associated physiologic changes with him so severe that he becomes prostrated. He didn't pass out, he collapses, but he's awake, and he's not unconscious, he collapses. So, through various steps, but without too much delay, he ended up here at Ohio State, or up at Ohio State. I'm no longer with the university, but at Ohio State. wherein it was determined that he had an attack of acute pancreatitis. Now, acute pancreatitis is a nasty problem, but usually it doesn't hit you quite that hard that fast. But it did in his case, and unfortunately, in this case, it became acute necrotizing pancreatitis, which basically meant that his pancreas had decided to auto-digest itself. Because there's nothing, what's in the pancreas? Digestive enzymes. What happens if it decides to become inflamed and leak on itself? It digests itself. What happens, then? Well, there's enough bacteria sort of floating around in the bloodstream coming out of and adjacent to the bowel that it becomes infected, and then you get just a massive king hell abscess in your retroperitoneum. And then what do? Well, you've got to drain that. How do you drain it? Well, there's various things you do. In this case, you had a hole on one side with a drain and a hole on the other side of the drain, and you're flushing. Also, you go in periodically and you scoop out the dead pancreas. Plop. Plop. I oversimplify, but that's essentially what happened. And then, of course, you get the associated problems with, pulmonary failure and, low-grade renal failure and all these problems. So, hence, the selection of this man to present to Dr. McCartier. I bet you thought I won't get back to that, did you? So, I was on stage. And I basically explained, with the numbers, because you had to give all the lab values. You had to give all the sequential lab values, and you couldn't use notes. You had to know them off the top of your head. Now, admittedly, every now and again you're going to fudge one of them, but not anything that's significant. It's and one of the key things when you present is you always throw the X-rays up on the view box with a plumb. It's like, you throw them up so that you sort of in one whack, so they stick under the thing that grabs it. There's some style involved. You got to do it right. So. So I presented the case, and then Dr. McCartier got up and discussed it, and it was great. I mean, it's wonderful to hear this man talk, about this problem. You're looking at or listening to 35, 40 years of experience, and this kind of thing. That's priceless stuff, Wow, what a privilege to engage in that exercise. Truly one of the more memorable moments of my medical training. And to complete the story, the guy ultimately, recovered and went home, but he was in the hospital 9 months. Of course, he was also on pancreatic enzymatic supplements, and he ended up taking. And I don't know that he was actually, you don't need many beta cells to keep from being diabetic, but I think he was, borderline diabetic at that point. He had to take occasional insulin, but he went home and he survived, and as far as I know, did well. After 9 months in the hospital. I don't know, maybe he's still paying the bill. Yeah. So, but he was a nice guy. Well, the whole family is, these were soul earth people, Southwest Ohio, go out and work, support yourself. That's where I came from. Alrighty now, guys. Bye-bye, YouTubers.